All right, so what we're going to talk about is doing a joint friction rub. We see this a lot with extremity pain, knees, ankles, elbows, shoulders occasionally, where there's been either some type of moderate to severe trauma or surgery. A lot of times around the incision point, there'll be a lot of scar tissue that builds up. And in that scar tissue, you get a lot of free nerve growth, and those free nerve endings cause a lot of pain, a lot of discomfort. Patients will come in and talk about when the weather changes, or if they're active, they start to hurt more in their joints, and they can't find any problems with it. There's no arthritis, there's no degeneration, or those areas typically don't even hurt. It's usually right at the joint line. And so the free nerve endings are sensitive to pressure changes, barometric pressure, chemical changes, which would be inflammation, pressure changes. Those things aggravate it, set the nerves off, and then they have pain. So what I'm going to do is patients typically will lay on their back. We're going to do the knee today, but we had a patient that came in, had navicular surgery, had 2 pins put in the navicular bone. It was been broken. They put 2 pins in it. The patient's had pain ever since. And what the patient was describing was pain on the outside of their foot, almost like a shooting pain that was going up the leg, where the navicular and the surgery was more on the inside of the foot. And in working around through the foot and then looking at the plantar fascia, looking at the navicular, we started to find this huge patch of scar tissue on the other side where there was another incision, and severe pain when I worked on it. So I'm going to show you what I do and what you're looking for. So I'm going to have you pull the pant leg up. I generally like to do the skin on skin. You can use lotion too. I almost find it's better without lotion. But what we're looking for is at the joint line. I'm going to kind of have you come in close here, Chris. Is you're going to have the joint line, and that's usually where I start. You almost never find scar tissue kind of out and around outside the joint. You're almost going to find it in and around it. Usually you see it on the inside of the knee, but we're going to work both sides. And expect this is going to be very painful for the patient, because you're breaking through these adhesions, you're breaking through these nerve endings. The results immediately afterwards are completely different, but expect the patient to be in some pain. I usually tell them, give me a pain scale as we're doing it. If it gets above a 7 out of 10, it's too much, it's too aggressive, we got to back off. Most of the time you're kind of at a 5-6 range. So what I start at is I'm going to kind of roll the knee out just a little bit. We're going to find the joint line, and what we're feeling for, and you can even see her flinch there, is kind of a crunchety, gristly feeling. That's what that scar tissue feels like, and I'm just going to kind of rub back and forth. I start out slow. Pretty tender? Okay, so she's shaking her head yes. I've now found kind of this gristly, crunchy area. She's telling me it's pretty painful. Now if I go down below it, it's very smooth. It feels like there's no real crunchy sensation. Does that hurt when I do this? But not as bad as the area above it. And that's where you start kind of moving around and begin to pinpoint these pockets where the scar tissue is set up. So now what I'm going to do is I'm going to use 2 fingers, kind of firm them up, and I'm going to go back and forth pretty quick. And I'm going to stay in one direction for a little bit. Now she's starting to flinch because it's pretty intense. 0 to 10, what are we talking? Okay.
5 or 6.
Okay.
Okay, that's like a 9.
Okay, so we're going to, and you may find little hot spots, and those are the ones that I back off. If I find one that's not so bad, I'm going to push in a little bit more. But basically we're going to go back and forth for a certain direction, and then I'm going to change directions. And now I'm going the opposite direction. Pretty intense. And the idea is to go very quick. And the way it was described to me is you want to move fast, you want to create a little bit of heat, a little bit of friction heat, and that helps to soften up and break down all of that scar tissue. The cool thing is, while this does really hurt like hell doing it, almost immediately there's relief, and because we're not talking about sort of a tissue damage of like a sprained ligament or anything where the muscles might be compromised, that patient can usually get up and go into their activity that day and perform better. It's almost an immediate change. Now, is that hurting a little bit less as I'm doing it? Yeah. Okay, and that's one of the things that should happen. If the pain intensity is going up and up and up, then either the pressure is too much or the area is too inflamed and too sensitive. What should happen is, as you do it, the pain levels go down and down and down, and it hurts less and less and less. So now we're going to go to the outside of the knee. And usually I do about 2 minutes per area. It might take 4, 5, 6 sessions. Now there's a spot. tender there too. If I get to here, there's no crunching, that doesn't hurt at all, does it? If I get up into here, nothing. But I get right on that joint line and crunch, crunch, crunch. So I'm going to start going one direction. We're going to do that again for about a minute, and then we're going to go the other way for about a minute. And what you'll notice is, one direction you may feel a lot of like little speed bumps and a lot of that gristly feeling. You switch directions and you don't feel it as much. And that's where it's important to go back and try it both ways. But again, almost immediately now. So we're doing both minutes. I would do it 2 minutes to each side. But it should feel better. The patients typically get up, they move their joints, they kind of, I might have them if they're younger and they're athletes, jump up and down a few times and just see if it hurts when they do that. Almost immediately it shorts out the pain, and that's something where the relief can last weeks to months. It might again take 4 or 5 sessions to get there, but we've had patients where they were looking at getting shoulder surgery. We do the friction rub, and it was 3 months later and they're still not having any more shoulder pain, where again you have all the rotator cuff damage and the scar tissue on top of it. You remove the scar tissue and the daily pain they're experiencing is almost alleviated and gone, and it should be that quick. It's one of those things that's almost an immediate gratification of it helps, it's better, and it lasts. But again, it may take 3 or 4 sessions where it slowly gets to that point, but once it's been broken down, the patient's good for a while. So hope that helps.